Hello and welcome. Today we're going to cut through the confusion and break down everything you need to know about diabetes in a really clear and simple way. Wow, have a look at that number, 5.8 million. That's the number of people in the UK who are estimated to be living with diabetes. To put that into perspective, that's about 1 in every 11 of us. And what's really quite shocking is that many of them don't even realize they have it. So, what does having diabetes actually mean for your day-to-day health? Well, in the next few minutes, we're going to explain what it is, how to spot the signs, and most importantly, how you can take control of your health. Okay, let's dive right in. So, what is diabetes? Put simply, it's a long-term condition where the amount of sugar in your blood gets too high. Now, this all revolves around a really important hormone called insulin. You can think of insulin as being a bit like a key. Its job is to unlock the door to your body's cells, to let sugar in so your body can use it for energy. So, when that key, the insulin, either isn't there or it just doesn't work properly, the sugar can't get into your cells. Instead, it gets stuck and starts to build up in your blood. And that's what leads to those high blood sugar levels that we see in diabetes. Right, so let's move on and have a look at the two main types of diabetes, which are type 1 and type 2, and see exactly how they're different. Now, what I think is really interesting about this slide is how clearly it shows the difference. You can see that type 1 is an autoimmune condition. That means your body attacks the cells that make insulin, so it just stops producing it altogether. Whereas with type 2, which is much more common, your body isn't using the insulin it makes effectively. And this table does a brilliant job of showing the warning signs. If you're experiencing things like constant thirst, feeling tired all the time, or losing weight without trying, it is so important that you have a chat with your GP. So, how do you find out for sure if you have it? Well, the good news is that a diagnosis is usually confirmed with just a simple blood test. This table really helps to make sense of the numbers. It shows the different levels, and you can see there that a key indicator called an HbA1c of 48 or above means a diagnosis of diabetes is likely. Okay, so once you've got a diagnosis, the focus really shifts to managing the condition, and the approach you'll take depends entirely on which type of diabetes you have. As you can see, the main treatment for type 1 diabetes is always going to be insulin because the body can't make its own. For type 2, however, the very first step is often making some really positive lifestyle changes. And for type 2 diabetes, these achievable little steps can make such a huge difference. In fact, sometimes they can even help return your blood sugar levels back down to a normal range, which is amazing. And if you need a bit more help, that's absolutely fine. There are medicines available, like Metformin, which can help you manage your blood sugar levels really effectively. Right, let's finish off by tackling some of the most common questions that people have about diabetes. This is a big question at the moment, isn't it? All this talk about modern diabetes medicines and weight loss. So here's the crucial bit. Certain medicines, which are known as GLP-1s, are licensed to treat type 2 diabetes, and they can also help with weight management. But, and this is really important, they're not a magic wand, and they must be prescribed by a healthcare professional. Another really important topic is foot care. It's something you hear a lot about with diabetes, because if your feet aren't looked after properly, it can cause problems. So the reason is high blood sugar can damage the nerves and the blood vessels in your feet. That means you might not even notice a small cut, for example. That's why checking your feet every single day is absolutely vital for preventing any serious issues down the line. Remember, just understanding your own health is such a powerful thing. And if you do have any concerns at all, the best next step you can take is always to have a chat with a healthcare professional.